the precautions to physically distance and to wear masks and so forth. In short, we've had 3 weeks now of going in the wrong direction with respect to the numbers that we're seeing on cases and hospitalizations. And the numbers that we're going to talk about today don't reflect, obviously, whatever might have happened this weekend. And the reason I mentioned this past weekend, the 4th of July, is we definitely know now that Memorial Day really was a point in time at which our numbers stopped getting better and then started getting worse. I pray and I hope that that does not happen with activity surrounding the 4th of July. We have lost all the gains made in June and are now seeing some numbers that rival our peak back in April. Today, we're reporting 1,891 new cases. That's on 18,139 tests. So the positivity on those tests is just slightly over 10%. 95% of the cases that we're talking about today are community spread. Only 5% represent spread or cases that come from a congregate setting. We are also, and unfortunately, reporting 20 additional deaths today for a total of 3,231. We did see a very slight dip in hospitalizations today, but I think it was only 3. But we are very concerned about the numbers that we see. And also, we're concerned because of conversations that we're having with hospital CEOs and medical directors, and I'll talk more about that in just a moment. But the total number of people hospitalized today across the state with COVID-19, 1,022. The last time we were over 1,000 was on May the 19th. And our hospitalizations have almost doubled since June the 13th, just to sort of illustrate what's going on here. The recent case growth continues to reflect that a majority of cases are now young people, and in fact 35 to 40% over the last several days have been individuals below the age of 39, I believe it is. Yeah. The difference today and what we were seeing 2.5 months ago is that 2.5 months ago, we had numbers that were really high, but they were driven by a hotspot in the New Orleans metropolitan area. So it was basically Orleans and Jefferson Parish, and it did expand out beyond that into St. Tammany and Plaquemine, St. Bernard, into the river parishes and so forth. But it was one region of the state that was fueling really rapid growth and high numbers, and the rest of the state didn't really see that to that extent. But now we're seeing more even growth in cases and hospitalizations across the entire state. And so from that perspective, Louisiana now looks more like other states and what they're currently experiencing, including our neighbors over in Texas. So we have a statewide epidemic. It's no longer one region or 2 regions out of the 9 that are really driving our case growth and our hospitalizations. With cases increasing, we've also seen increased demand for testing across the state. And the Department of Health is aware that some testing sites have been very slow in getting results to the people who were tested. You may recall that there was a time when there was an international and national shortage of test collection kits, swabs, viral transport mediums, and so forth. There was really a limiting factor in being able to test at the numbers that we wanted to. Today, the limiting factor appears to be the availability of reagent in the commercial labs. And because reagent isn't in the commercial labs in the amount necessary, those labs can't process timely and report back the results of the tests that they're receiving. And that's something that I know that they are working on. I know that it can be very frustrating to test, thinking you're going to get the results back in a couple of days, and sometimes it's 7, 10 days, and I've even heard of cases that were taking longer than that. So we're all concerned about the delays, because quite frankly, if someone's been in contact with someone who is COVID positive, they really want an answer. The other reason that I'm concerned is those individuals could be positive, may be asymptomatic, and they're not taking the proper precautions by quarantining to make sure that they're not unnecessarily exposing others. So we all have a common interest in getting these tests performed and the results back just as soon as possible. It is critical for anyone who's been exposed to someone who's tested positive to the virus to self-quarantine for 14 days while you wait for your test results. And I want everybody to listen to this, and I'm going to ask Dr. B to address more about this later when he speaks. But if you have been in contact with someone, close contact, who is COVID positive, even if you test negative, you need to quarantine for that full 14-day period, because that disease, you might have contracted it, but you don't yet have a viral load that's necessary to test positive, but it doesn't mean that you aren't positive and so forth. So the 14 days continues to be critically important. In the midst of all of this, I am pleased to share some good news with respect to testing, and that is that yesterday the HHS supported surge testing in Baton Rouge that I announced last week got up and running. It was short-lived yesterday because of the horrendous weather that came through this area. But HHS, and working with Dr. Birx and the White House Coronavirus Task Force, picked 3 cities in the United States of America for this surge testing: McAllen, Texas, I believe it's Jacksonville, Florida, and Baton Rouge, Louisiana. That should tell everybody in the state of Louisiana all that you need to know about whether we have a serious situation and whether it's getting worse. We do, and it is. But we appreciate the fact that we're going to have this additional testing where the goal is to test 5,000 people a day above at these sites. There are 4 of them, and this is testing above the baseline so that we get a better idea of just how many cases we have, particularly in the Baton Rouge area. And you don't have to be a resident of Baton Rouge. You can live in a nearby parish, if you're in West Baton Rouge, Livingston, Ascension, whatever. If you want to come in and be tested, you can. You can be tested if you're symptomatic, and you should be. You can be tested if you've been in contact with someone who has COVID-19, and you should be tested. But you can also be tested at these surge sites just if you have some concern that you may have COVID, even if you are not symptomatic. The goal is to test 5,000 people a day across the 4 sites. Those 4 sites are at LSU, Alex Box Stadium. They're at Southern University at the Clark Activity Center. We have a site at the Cortana Mall, and the 4th site is at Lamar Dixon and Gonzales. More information can be obtained by calling 211. The testing will run through July the 18th, so this is not a long-term commitment. This is a hotspot surge testing effort. You can pre-register. We do recommend it. It is not absolutely necessary. But to pre-register, you can go to doineedacovid19test.com. doineedacovid19test.com. This morning, I had a very good call, Secretary Phillips and I, with about 20 hospital CEOs and medical directors from all across the state, every region of the state, to get an update directly from the field. Obviously, LDH has these calls every day. But I wanted to hear directly from the hospitals as to what they're seeing. I do appreciate the Hospital Association for helping us to facilitate the discussion today and being a strong partner throughout the crisis. Nearly every CEO and medical director on the call reported sustained increases in COVID-19 hospitalizations. And as I mentioned, we've completely lost the gains that we've made over the past couple of months, and all of this has happened just in the last 3 weeks or so, and that's very concerning to me because there are some people out there who I think continue to believe that the state of Louisiana continues to do better, and that is not the case. It's not the case in most states around the country, and I don't know what the last count is, but I know within a couple days ago I was looking at something that said upwards of 40 states actually have increasing cases, and most of those states also have increasing positivity as well, and we certainly have both of those. We do have some regions that are actually above the hospitalization numbers that they ever saw in March or April. And particularly in Lafayette right now, the two largest hospitals in Lafayette each have more COVID-19 inpatients than they had at the height of the earlier surge in cases and hospitalizations. Now, there is a little bit of good news, and I say that you kind of have to strain to pick out good news right now. But the patients that they are seeing, on average, a little younger. The illnesses, on average, are not quite as acute. And the stays in the hospital are not quite as long. And a smaller percentage of these individuals are in ICU beds or on ventilators. So those things are relatively good if you cherry pick that out from what we know was happening previously. But there are challenges. One of those has to do with access to remdesivir, which is an approved therapeutic treatment for seriously ill inpatient COVID-19 victims. And we had a couple of hospitals tell us that I don't think any told us that they're out, but based on current caseload and what they've seen coming into the hospital recently, they're concerned about not having adequate supplies of remdesivir. So we're working on that as quickly as we can. And I would remind people that hospital capacity is not just an issue as it relates to COVID-19, because while we're in this public health emergency, this pandemic, that doesn't mean that fewer people are going to have strokes and heart attacks and motor vehicle accidents and those sorts of things. The biggest challenges that we heard from the healthcare community this morning center around staffing, keeping adequate supplies of therapeutic treatment like remdesivir, and then, of course, the testing issue that we already talked about. One hospital CEO told me this morning that the staffing issues are exacerbated by the fact that the community spread is so pronounced that more of the nurses and other staff members at the hospital are actually out because they too are positive. So that's another indicator just how pronounced the community spread is and how detrimental it is to our overall efforts. We are also hearing, and this is somewhat anecdotal at this point, but it was echoed by the vast majority of regions that we spoke to today. We're seeing a slight change in the demographics of the patients that they have admitted over the past several weeks with COVID-19. They skew a little whiter now and more male than was the case previously. And again, as I mentioned, the average age is down, so that on average the patients are younger than they were before. We all know that there's been a huge push in the African American community to highlight the problem related to COVID-19 and to promote the mitigation measures like masking and other facial coverings like social distancing and washing hands and staying home when you're sick and so forth. And it appears now, at least anecdotally, that the patient mix at our hospitals looks more like our state demographics as a whole. And I appreciate all of the hard work that everyone has done, especially the medical community, and I appreciated the time that these hospital CEOs and medical directors put forth this morning in order to speak to us and give us their best information. But I want to reiterate that we all have a role to play, and it's going to take all of us being focused on the task at hand, and particularly complying with the mitigation measures that are in place.